there's no question that people are not getting the treatment they need when they need it. That has direct consequences, which can sometimes be life-threatening.
What did you make of that warning from Adrian Boyle of perhaps as many as 500 deaths a week caused directly by the delays?
I don't think there's any point hiding from the public that the pressure that the NHS is under, the gap that exists between the demand that we face and the capacity we've got to meet that demand, does mean that there is inevitable risk and there is inevitable harm. And I think how you quantify that is difficult to say, but there's no question that people are not getting the treatment they need when they need it. That has direct consequences, which can sometimes be life-threatening.
Yeah, I mean, we've heard a catalogue of incidents over the weekend. The Sunday Times had a patient forced to wait for 99 hours for a bed, a picture of a seriously ill child asleep on a chair in a waiting area, other patients forced to sleep on floors. I mean, this really does point to a picture of a service that is frankly struggling to cope.
Yes, I think that's right. And so I think we have to ask ourselves two sets of questions here. The first is, how do we get through the next few weeks? And I think that that is a combination of being clear and honest with the public about the pressures we're facing and asking the public to use the NHS as responsibly as they can. And the way the public behaves can have an impact. We saw a few weeks ago during the ambulance worker strike that the number of 999 calls went down significantly on that day. Now, some of those people should have called 999, and that just stores up greater problems for them and for the health service. But it's also clear that some people realized that they could use 111, they could use primary care, and that did lift the pressure, and that was incredibly powerful for us to help us get through that day. So there are things that the public can do. So I think we need to be clear to the public about our message and about what we're asking them to do to help us get through these next few weeks. And then secondly, we've got to get back to the negotiating table, because if we have 4 days of industrial action in January, which is always our toughest month on top of everything else, then these problems of patient risk and patient harm are going to grow. So the first thing we need to talk about is, how do we get through the next few weeks? And the second thing we've got to talk about is, what is the national plan that we need to make sure that we don't go into next winter in the same state of fragility that we've gone into this winter?
So much to discuss. We've seen a number of different trusts declaring critical incidents. Do you think it is time to declare a national major incident in the NHS?
I'm not opposed to it. I'm not sure what difference it would make, in the sense that the reason you declare a critical incident is really to signal to the public, to your staff, that you can't provide the level of service you want to provide, that you're encouraging staff to come off leave if they can, you're cancelling meetings and training and all those kinds of things, putting everything towards the front line. But also, sometimes you declare a critical incident in the hope that other trusts or health systems around you will come to your aid. The problem is that the pressure is so great across the board that, in a sense, if you declare a critical incident everywhere, it almost undermines the whole idea, because how can a system where everyone's under pressure support each other? So, as a bit of signalling, maybe it is a way of explaining to the public the situation we're in, but I think the public are quite aware of that.
What about, you talked there about just getting through the next few weeks. What does Rishi Sunak need to do now? We haven't heard very much from the Prime Minister about any kind of overarching plan for the NHS. What should be the immediate priority? Clearly, there are huge long-term problems, the backlog and so on. But as you say, we've got to get through these next few weeks.
Yeah, well, I think the number one priority for the Prime Minister is to heed the call that we made to him personally before Christmas, which is to ask the Secretary of State for Health to go back to the negotiating table. And look, in these negotiations, both sides are going to have to move if we're going to avoid industrial action in January. But it's pretty clear at the moment that the reason negotiations can't even start is that the government won't talk about pay. And I think the government needs to be pragmatic, be creative, recognise that it needs to talk about pay. The trade unions similarly need to be pragmatic. Because if we have 2 days of ambulance workers strikes, 2 days of nurses strikes in January, then further to follow, this really is heaping misery upon misery. So that's the first thing. And then the second thing I think he can do is to commit to do whatever is necessary to make sure that we enter next winter in a less fragile state. Because one thing to reflect on is that, in the middle of COVID, when we were under the immense pressure we were under, and we were applauding NHS staff, we were all committed, weren't we, to learning lessons from COVID. Now, the big lesson from COVID for the NHS was that if you go into a crisis in a fragile state, as we did with COVID, we had 100,000 vacancies, we'd had a decade of underinvestment, poor capital investment. Then when you hit a crisis, it's hard to manage.
Okay.
And we in the UK saw waiting lists rise much more than other countries, for example, because we weren't able to continue to provide that service as well as meeting the demands of COVID. Now, it doesn't look as though we've learned that lesson. So, the government has taken some steps to help this winter, but they announced the money too late. They distributed it too late. So it's going to require really concerted effort to make sure we do not enter next winter in the same state of fragility. And I think if the Prime Minister was to commit to that, it's not going to help for the next few weeks, but it would give a sense of hope going forward.